Doctor, you mentioned before the auditory meatus. Yes, the external auditory meatus. And the meatus is what? Well, it's a sort of a channel. And is a foreign body in the external auditory meatus good or bad? It is bad because it results in a papilloma. And otoscopy with removal of a foreign body is the operation of choice? Well, that is not so, in my opinion. The excision of the papilloma is the operation of choice. Can there be an amputation of the ear? Yes, we call that an otoplasty. That is the removal of the ear? Yes, the plastic repair of the ear. Doctor, otoscopy is what? Well, you are talking of the endoscopic examination of the external auditory meatus for removal of foreign bodies or lesions. Doctor, what is a paracentesis? In an otitis media, you have a paracentesis or puncture of the eardrum and evacuation of fluid from the middle ear. Is that also a laryngotomy? No, a laryngotomy is the incision of the eardrum and drainage of the middle ear. Doctor, this patient suffered from what? From a perforation of the eardrum. And that is a laryngoplasty, you say? Yes, laryngoplasty, the reconstruction of the eardrum. Did that involve the middle ear, doctor? Yes, the otitis media acute or mastoiditis acute. And was there a complete mastoidectomy done? Not by me, but by another expert, scooping out and obliterating of the infected air cells is a complete mastoidectomy. It is the removal of the diseased mastoid process. Doctor, that has to do with the middle ear? Yes, the middle ear or the mastoid. The otitis media is chronic and suppurative, and mastoiditis is chronic also, suppurative or recurrent. And was there a radical mastoidectomy or a modified radical mastoidectomy done in this case, doctor? It was the repair of the middle ear. And what does that encompass? It encompasses the end-oral approach to temporal bone and thorough removal of the diseased tissues. There is a surgical creation of a new cavity composed of healthy mastoid tissue, the tympanum, and external auditory canal. Doctor, you mentioned mastoiditis. Yes, an inflammation of the mastoid. Was that chronic? It was chronic, and it was a perforation of the tympanum. And what was employed to correct that? A tympanoplasty with or without mastoidectomy. It is a closure of the perforation by a skin graft or vein or fascia or perichondrium. And this perichondrium, doctor, is where? It is in the middle ear. Is that a sclerosis? Well, we call it an otosclerosis. That is the conductive deafness with fixation of the stapes. And the stapes are a mobilization operation. It is a surgical opening and loosening of the stapedial foot plate. Doctor, is that called a stapedioplasty? Yes, it is the removal of the stapes and insertion of a delicate prosthesis to replace the stapes in a stapedial type of operation. Now, let me ask you finally, doctor, with respect to the vein plug stapedioplasty. Yes. What is that exactly? That is the removal of the entire stapes, the insertion of the vein plug, the creation of an arthroplasty for intact sound conduction. Doctor, is that called a fenestration operation of the oval window? Well, it is a removal of the stapes and footplate, the creation of a new oval window, and the replacement of the stapes. Doctor, what about the internal ear? Well, that is affected by Meniere's disease. What is Meniere's disease, doctor? It is a labyrinthectomy. That is, the operation is called a labyrinthectomy, which is the end-oral or post-oral approach to the inner ear. And could that result in an exenteration of the ear cells? Yes, the removal or exenteration of the ear cells. And also an avulsion? Yes, an avulsion of the endolymphatic labyrinth. It is essentially the destruction of membranous labyrinth. Doctor, is it unilateral or bilateral? It is bilateral if it is ultrasonic. The selective destruction of osseous vestibular labyrinth by ultrasonic waves, avoiding bombardment of the cochlea. Finally, doctor, the vestibulocochlear nerve is involved in the acoustic neuroma? That is correct. And the solution or cure is an excision of such a neoplasm. It is the removal of the neoplasm which involved some area of the neural passageway of the hearing.